What is autism?
It's a spectrum of manifestations or features that children or adults may have.
Do we have enough experts?
Short answer, no.
What does it mean specifically for ASD?
We call it autism spectrum disorder because it is a spectrum.
What kind of schools can support children with autism better?
I think we must have inclusive schools.
So would you say that these kids typically have a lower IQ or...
So a person with autism usually has a normal IQ. Something called autism plus, which is autism with other stuff. Other aspect they have is sensory issues. Auditory, vision, smell, touch, taste, balance.
Is it something you're born with? Or can you develop it later in age as well?
So till today, we don't know what causes autism. Okay, it's $1 million question, and I would say majority of the research in science today is working on autism.
Hi, this is Namita Thapar, Executive Director of MCure Pharmaceuticals. Today is Autistic Pride Day. We all hear about people around us having autism, but we don't know much about it. It's important that we understand this condition, we support the people around us, we know how to interact with them. And for this, we have two experts with us today. We have Dr. Anaita and we have Archana, who runs Jai Vakeel Foundation. So we'll start with you, Doctor. What is autism?
So I think today, instead of using autism, I would say autism spectrum disorder. Okay, so it's a spectrum of manifestations or features that children or adults may have. When you look at the development of a person, you have 4 domains. You have your motor skills, which is jumping, running, hopping, skipping. You have fine motor, which is finger function. You have social milestones or development, which is how you interact with the world and people at large, and communication, how you interact and talk or connect with people. So children with autism or adults with autism usually have a problem in the social and communication domain. They're absolutely fine in motor, fine motor condition aspects, but they have a difficulty with communication, socializing, and they have a tendency for the same thing. They tend to like the same thing. So when you're saying communication, I'm not talking speech. Okay, so you just with your body language sitting forward, you're telling me you're listening. Your eyes are making connection with me. You smile at the correct moments. So you are communicating with me even in the absence of speech. So whether it's eyes or body or hand function, or it is understanding and then speaking accordingly, communication has a whole array of them. So when we work on it, we work not just with speech down the line, we do verbal and non-verbal type of communication, which helps them go forward. Socializing is how you interact with the world and people. Understanding where you are, picking up the clues of the situation, integrating it into your internal system, and then responding in a way which is appropriate to the situation. Okay, so in a mall, I will hold my mom's hand. In a movie theater, I know it's going to get dark and the sound is going to be loud. I can't run around and shout in the middle. Or if I go to a restaurant, I know I've got to sit for half an hour before food comes. These are things you never have to teach a person. They just happen automatically. So picking up the clues of the environment, integrating them, and then responding. And likewise for people, reading their body language, and then, your words change. Just looking at a person's face, you will change the way you express something. So that is a problem they have as well. They cannot pick up the clues. They cannot pick up the language that people are trying to connect with them, and they don't respond appropriately. They respond the way they want to, with the people they like, in the way they want, in the words they want. Everything is on their terms. The other aspect they have is sensory issues, okay, where what are our senses? Auditory, vision, smell, touch, taste, balance. So if I like something, I will repeat it again and again and again and again, and this can be endless. If I don't like something, you cannot make me do it even if you drag me to it. So we all have sensory issues, likes of you, me, Archana, all of us. We put our towel back in a certain way. We put our coffee back in a certain way. We set our table every day in a way that we like it, or we teach people to do it the way we like it. So it's not that only they have issues, but when a sensory issue becomes a disturbing factor, when it internally disturbs you and gives you anxiety because that cup is not put the way I wanted it to be put, that's when it's gone beyond it being a normal variation. So if they like it, they will do it again. So he'll pick up the cup and put it back exactly. If you move it a little, he'll put it back again. Move it a little, he'll put it back exactly there. So little things like that. And this gives them anxiety. So one of the things with children with autism is you want to avoid anxiety because that doesn't, it's not a good foreboder for any behavioral issues down the line.
Absolutely. And you mentioned one more point about getting fixated on certain things. So I've heard that a lot of times just constantly looking at a ceiling fan moving or just the rotating car wheels, these are things where you pick up that if a child is fixated on certain motions, that also is a sign for autism. Is that correct? Is that what you meant by fixated on certain?
That's right, it's true. They have a fascination for spinning things. So in children, it'll be the fans, it'll be the wheels. All their toys will be wheels of the car, wheels of the bus. Parent doesn't realize it's the wheels he's fixated. Parent thinks he likes cars, he likes buses, he likes trains, he likes that, but it's really the ability to get into a spin and then just stay focused on that. That's what they have. So wheels is one of the things. Many of them have other. So if I have tactile stuff, I will only want the same shirt or the same cloth to put myself to sleep or whatever. Haircuts and teeth brushing is difficult. Bathing, and you'll have water on your body, but you won't want water on the head because it disturbs you. Food, many of them are fussy eaters. So if you have oromotor sensory issues, they want food in just the right consistency. It's not the taste of the food, it's the consistency. So you have to mish it to that proper consistency, he'll finish it in 2 minutes. But today your mixie doesn't work, dad will not realize that mom has used her hand, but he will know in 2 minutes that the mixie hasn't worked and mom has pressed it with that, and he'll refuse to eat.
That particular.
They are very sensitive to change in whatever aspects they are. Everyone doesn't have all sensory issues. So you'll see when you see some of them, they're more auditory sensitive. So sounds disturb them. Okay, or some are more tactile, clothes and touches disturb them. So if I try to pick up a kid with autism, he'll most likely squeeze out and run out of my hand because he doesn't like my touch. But now he likes his mom's touch because he's gotten used to it over time. So that's what you call desensitization. One of the treatment options is you desensitize them to the sensory issue that you have identified them to be sensitive to.
So Anaita, coming back to this being a picky eater or not wanting water on their head, I mean, being a mother of 2 kids, we see a lot of kids having this.
Absolutely.
So is it that we see it in a lot of kids and most kids outgrow it with age? I mean, how do we know if we're seeing some of these very common things that you mentioned, whether it's a sign for autism or something that a child is just going to outgrow?
So that's when I said all of us have sensory issues.
Right.
But the response you get to that sensory issue will somewhere give you an idea as to whether it's beyond a certain point or that. So many kids don't like water on their head to start with. But then you counsel them and you speak to them and it happens and they learn to accept it. But if I have a meltdown and I throw a tantrum because water touched my head and I just can't take it, that means I've become, it's beyond the point of just accepting it and learning it with happiness.
Is it fair to say that a lot of kids are born with it? Is it something you're born with? Or can you develop it later in age as well?
So till today, we don't know what causes autism. Okay, it's $1 million question, and I would say majority of the research in science today is working on autism. So many a parent will come to you and say, Doc, he was absolutely fine. He was saying Mama, Dada, Tata at 1 year of age, and now at 2, suddenly everything is gone. So they have that fix about the vaccine with it because that's the age you give the vaccine at 18 months or, 24 months or this. And that's when the vaccination is given and suddenly the speech. But that's the time when the regression actually happens. But if you look back carefully to all these children and you ask parents, pull out their photos, pull out their videos, you'll see they never look at the camera when the snap is being taken. They don't make eye contact properly like a normal kid would. A normal kid connects with you, smiles, coos, follows you, tracks with you. They're a little disconnected and that they'll make their noises, they'll make their movements, and a parent just thinks it's a child.
Right.
They're not aware that the child should be like looking and tracking and following you through every action that happens. So it's usually there all along when you see it. It becomes more evident, obvious, and noticeable when the speech doesn't come, which comes at about 2 years. So at 2 years, we start with pani do, pani chahiye, 2-word sentences, 3-words, and when that doesn't happen, the penny drops that maybe something is amiss. And by definition, you would not label a person as ASD or autism spectrum disorder till they're roughly 3 years of age. So usually most of them should manifest by 3 years of age.
That's a very important information to know. And you just mentioned the word spectrum. when you said ASD. So we hear this word a lot, right? Spectrum, range. What do you mean by that? I mean, I know it could mean mild and moderate and severe. What does it mean specifically for ASD?
So first we used to call it autism. Okay, then the definition has changed and now we call it autism spectrum disorder because it is a spectrum. So the severe one is someone I think anyone would identify. Doesn't look at you, is running all over the place, very difficult to control, behavior issues, tantrums, meltdowns, etc. But the mild one is someone who has just sensory issues or just communication aspects or just socializing aspects or a little bit of all three but can manage through life comfortably otherwise. What you would have called Asperger's in the previous classification today was someone who could communicate but was socially and disconnected. Okay, so you have the movie Rain Man, for that matter, if you remember. That was maybe the first movie that came out on a person who had autistic features, where he would connect. He had a gift of seeing numbers and putting pieces together, but he was a little socially inept. His communication was only related to what he wants. So they will communicate on what they want, not on command. So you'll ask, did you eat your lunch today? Yes, I did. What did you eat? Cucumber. But it's not like, Mom, you know what the teacher did? She put me in the corner because I dropped a book or I hit a friend or whatever. So there's no spontaneous speech. It's speech related to what you have. So you have those who are socially a little inept. We see it in so many people in society.
Right.
And many of us are going to work and living a normal life with it. I may not chat with everyone in office. I may be prefer to be on my own. I come in, I go out, I do my own stuff. I have my family. I don't want to be the talk of the town.
Just pause here a little bit, because we hear this word introvert versus autism where you are socially inept. How do we differentiate between the two?
So basically, again, the main thing is an introvert is a person who may not want to communicate or socialize that much, but he has all the skills on the table. You get it? He doesn't have a problem with the skills. So you put him in front of an interview and you say, even if you're an introvert, talk to me and tell me about this, he'll give it because he realizes the interview is important. He knows this is the moment he has to perform and his life or his future depends on this interview, so he will do it. A person with autism spectrum may decide, I don't want to talk to you today. I don't want to answer the teacher when she asks me what is 8 plus 8. You get it? I know 8 plus 8 is 16. I know everything very often. But I don't need to look at her. I don't need to answer her. So they look away. They won't answer when they are asked for. So parents struggle with, will he perform at the time that I want him to perform? And invariably, because of that, they get clubbed into, not smart enough or academically not good because they don't perform on command.
But coming back to academically not good, we hear about intellectual disability, which is IQ of a certain level. So would you say that these kids typically have a lower IQ, or can they have absolutely normal IQ?
So a person with autism usually has a normal IQ. Okay, so their cognitive skills are absolutely intact. Whether he wishes to express it and show it to you, that's a totally different issue. So very often when you scale them, you may not scale them to their proper IQ because he does not want to answer when the therapist or the psychologist is asking him. However, you have something called autism plus, which is autism with other stuff. And yes, about 20 to 30% of them may be autism plus, where they have associated, they may be syndromic, they may be secondary to epilepsy, secondary to Fragile X syndrome, different types of conditions where your intellectual capacity might be slightly low. So it doesn't mean that all people who have autistic features have normal IQ, but if you're just pure autism, yes, you have normal IQ, and you have normal motor skills, normal fine motor skills, you only have social and communication issues.
And you said about 20 to 30% could have a co-condition.
Yes.
Now, when you say co-condition, would that also mean things that we hear very often, such as ADHD, OCD, schizophrenia, and all of that?
So the commonest things that would come with autism as a co-condition would be syndromes, okay, or genetic syndromes. So Fragile X is a common condition that has autism as part of it.
What does Fragile X mean?
Fragile X is a syndrome seen only in males predominantly, where they have mild intellectual disability, mild autistic features, and they have faces which are a little what we call dysmorphic, triangular, with large ears, pointed chins, little things like that. And it's one of the syndromes that we have. So like you have Down syndrome, you have Fragile X syndrome. So syndrome is a conglomeration of symptoms put together and it makes a picture where people can predict the outcome by just knowing the name of the picture. Like Down syndrome, normally they're happy, cheerful, fun, dancing, smiling, lovely children. 10% of them will have autistic features. You get it. So that's one part of it. Epilepsy, sometimes if you get epilepsy in a very young age and very frequent and difficult to treat, invariably it affects the circuits of the brain and they get autistic features. So it's very interesting to note that because it indicates that early brain development, particularly the first year of life, has the ability to change your circuits if something comes and disrupts it and gives you features which are suggestive of autism. And then you have other Sturge Web, other conditions which have autistic features in it.
Understood. So this we spoke about co-conditions. Let's talk about complications, right? Because I've read that autism, in, again, certain percentage, not all, can lead to certain health complications. Can we talk about that?
So the health complications you would be concerned with is, one is, yes, academic. Okay, that's one thing. They're not identified to be as good as they are because of their skills. 50% of children with autism might have seizures. Okay, so they might have a tendency to epilepsy. It's usually relatively easy to control and treat, but 50% is a big number.
Very big number.
Okay, so that's the other thing. Children with autism may not be able to tell you they have visual problems. So you need to do testing regular intervals to see that you pick it up rather than a child telling you, I can't see the board, and very often behavior goes for a toss if these little things are missing and not looked into.
Absolutely.
Other than that, they have no major concerns. You would vaccinate them like anyone. Their illness spectrum is the same as anyone. Their life expectancy should be as good as anybody else. However, if I don't understand risk and, pain and complications that well, I may not behave appropriately and I might get hurt or damaged or injured sometimes accordingly.
So these are the things we should, as support or caregivers, watch out for.
Yeah, and many of them also have a common thing is ADHD. As you brought up before, many children, a large percentage of children with autism have associated ADHD.
What percent would that be? Like you said, almost 50% have epilepsy.
I would say roughly 50 to 70%.
So that's again a very high percentage. And these are things we should be very aware about.
Yes. And sometimes ADHD can get you into trouble more than the autism would get you into trouble.
How is that?
So ADHD is hyperactivity, impulsivity, and concentration. So physical hyperactivity is the hyper, seen more common in boys, maximum till 10 years. Usually after that it peters. The inattention or concentration is more evident in girls than in boys, and it's seen usually after the first decade, where academic scores start dropping because if I'm not concentrating and listening, I can't connect with what the teacher said. And the impulsive part of it, where I do things without thinking of the consequences, is what gets us into trouble. To understand where to draw the line. And, beyond this line, I can hurt someone or I can hurt myself. I can do something which will have repercussions, which will be long-standing. That doesn't click in sometimes.
Understood.
And then we end up with a little problems.
So, you gave us a lot of education on what to watch out for. Let's say I see this in my child. Which doctor would I go to? What are the tests I would do to confirm my assessment that my child may have autism?
So really the first person a child would go to is to the pediatrician. So your pediatrician, with time, I think now more and more pediatricians are able to pick it up and they would refer you directly to a therapy center or to a developmental pediatrician, to a neurologist, and sometimes they even reach a psychiatrist. So there's a spectrum of people who can look after this child. Diagnostic-wise, there is no single test that can give you the answer. So the MRI, if you do, usually is normal. Yes, they say the head is slightly larger in children with autism because there is a lot of circuitry which is happening. And at a certain age in life, roughly 2 years of age, the circuits that we are born with start dropping off. Okay, it's called apoptosis, or normal cell death of a cell or a circuit, which happens because circuits which are reinforced will stay for life, and circuits which are not reinforced slowly start dropping off. So that's why children who are stimulated have much better circuitry and have good, strong pathways in the brain, as against those in orphanages who are just left and there is no circuitry which is there. And in autism, one of the concepts is that the circuits are too many and that drop-off doesn't happen. And that's why there's a little bit of chaos and mayhem inside the brain with so many circuits, and that's why their condition or their features happen. So there's no clean test, not an MRI. There's no blood test that tells you it. You can do psychology assessments. Okay, so you do different scales that we use, CARS, GARS, depending on the age of the child. There's the Indian autism scaling system. There are, the AIMS autism scaling system, where we can identify a child with autism spectrum disorder. Does he have features? Does he have pure or frank autism? And does he have mild, moderate, or severe?
Understood. And how would you treat a child or an adult who has autism? What are the treatment options?
So if we don't know what's causing it, we don't have a handle on what to give. So there's no magic medicine. There's no magic therapy. There is no magic one fix that works for a child. So usually what we do is we refer the child to a team. Okay, so the communication goes to a speech therapist. The sensory and the socializing goes to the occupational therapist, and they do sensory integration, where I explain you desensitize the child. We do behavior therapy, which is I usually recommend more for parents than I do for children. Why? Because a parent has to know how to handle their child. Remember, autism is something that's with you for life. It's not going away. So one question most parents will say, Doc, when will this go? I mean, how many years do I have to do it, and then when can I stop? And then you have to tell them, listen, there's no quick fix. There's no time-bound answer to this. So the faster you learn to handle your child and manage them, you are the only constant factor that will stay with your kid forever. You get it? So you will be able to handle him even at 13. He has an interaction with a girl or a teacher or something in class which upsets him or disturbs him. You will know what to tell him, how to say it, how to change his mood so that he accepts what it is and move on.
Right.
So one is the focus on the parents. So in the initial few years, this is conventional therapy, OT, speech, behavior therapy, aqua therapy, music therapy, art-based therapy, animal therapy. There are lots of, look at the variation you have. So from conventional of OT and PT, or occupational and physio really, and speech therapy, sorry, no physio, speech therapy, you're moving to natural-based therapies, which is art, music, animal, and then you move to, what's the best thing is extracurriculars. What's the aim of all this is you want your kid to do what a normal child does.
Right.
Correct? What does a normal child do at 3, 5, 7? He's on the playground, he's playing football, he's doing tennis, he's swimming, he's going with his friends. Start that from the beginning. Keeping them in this artificial space and then saying at 8 or 10, I will put him in, you're losing that time frame.
Right.
So put him into swimming, football, dancing, even if he doesn't listen to the teacher, even if he doesn't connect with the children, even if he doesn't kick the ball when you ask him to, he's just watching and he's seeing, and slowly that gets into.
This is such a beautiful segue into now moving to my dear friend Archana. I must say, Archana, it was a wake-up call for me personally when I visited Jai Vakeel Foundation, and you deal with over 700 children and young adults. And Anaita so beautifully told us about the technical terms, what we should be aware about. But in your foundation, I saw all this in action. The music therapy, the art therapy, the speech therapy, having the specialists, working with the parents. I met a lot of parents. So I would love to hear from you that you've been working in this space for a very long time. Who are the team members that you work with? And how do you ensure that our children and young adults with autism get the best possible care and are celebrated for their differences?
Thank you, Namita. I think it's really special that you're doing not just this podcast, but I think you coming, visiting and seeing for yourself, what really happens on our campus, because meeting and interacting with the kids really is where the magic happens. So Jai Vakeel was started in 1944, right, by Mr. and Mrs. Vakeel, who had a daughter, Deena, who was born with Downs. And I mean, I said it so easily, but this is our 80th year. So Jai Vakeel's been around serving this spectrum of children for over 80 years. We have 700 kids that we work with directly. I'm sorry, I keep saying kids, but we have 700 kids as well as adults that we serve directly on our 3 campuses through interventions like healthcare, education, and skill development. All the people that we work with have intellectual disability, right? And because your brain is affected over here, very often, like Anaita said, they have it's bundled with some other condition, which could vary from visual impairment, hearing impairment, cerebral palsy, autism, and or some combination of this. You know, in our space, there was no standardized curriculum. So we built one that was applicable and relevant to the children that we work with. We then partnered with, this was certified by NIPID, which is a national body in our space. And then we've collaborated with the government to actually reach out. And today, 475 schools all over Maharashtra are using the curriculum under Disha project. So 20,000 children are now getting the benefit of this curriculum. We also have children and adults who have intellectual disability and autism. So when you couple these, it's a really hard space for not just the child, but also for their families. Because of the conditions that Anaita just talked about, which is varying from sensory perceptions to behavior to communication and social interactions, very often my child with autism, who also has intellectual disability, cannot be part of a bigger classroom on day 0. And therefore, we have a separate autism section where we provide exactly what Anaita talked to. You know, we have goals are taken for a child on an individual basis. But before the goals are taken, I think the conversations with the parents are, why am I doing everything that I'm doing? Right? And our big picture goal for every single person on our campus is inclusion. We've broken that down to be that the inclusion first needs to be at the family level. Then it moves into at the society or within the society that you live, and then follows, community, and then follows society at large. So with this goal in mind, we first take goals, which are smaller goals for the child on our campus in the autism section, which is more based on their strengths. Right? And we're trying to come at this with a lens of that every child can do it, right? And when you're working with the child and the parents, you have to work with the parents, you have to work with the families. The whole lens is again of this neurodiversity affirming approach. Right? When these goals are taken, they're always collaborative with the parents, because it's not about the child being set up for success in the classroom. It's also in the homes and in life in general. We then invite the parents to actually come watch what and how we're teaching, not just in the classroom, but during therapy, so that they can continue to do that and generalize those situations in their own house, right? And when we are doing all of this teaching, there are various adaptations that are made, right? Because like Anaita said, it's not a one size that fits all.
You have to tailor make, you have to individualize each
You have to individualize it. So what does that mean for my child with autism? It could mean that when I'm doing an educational goal, I'm using an iPad, because honestly, they're better visual learners. It could also mean for the timetable for the day, he has a visual timetable. So like Anaita again said, he knows what to expect, and this reduces his anxiety, and therefore he's more participative in that instruction thing. So these are some of the things that we do. And when the autism behavior is managed or manageable by both the child and our teachers or therapists, the child is then integrated into a larger classroom on our campus itself.
Fabulous. And you know, you mentioned that your curriculum has been used by over 20,000 children, but a lot more in this country need it. So what do you wish, you know, if you had this magic wand, that the country would do differently in terms of more resources, government support, just overall support, so that more than 20,000 kids can benefit from the kind of support that you're providing?
That's a great question, Namita. And I think, you know, sometimes when I reflect, like today we're talking numbers of 20,000 and 700 at Jai Vakeel directly, etc. I think the problem really starts from here. We do not have adequate government data that actually helps us to even understand the magnitude of the problem we're dealing with. What do I mean by this? 2011 में census हुआ था. In that census, information was captured like, you know, which member of the family has visual impairment, hearing impairment, cerebral palsy, and even mental retardation, because that's the word or terminology that was used way back then. Right. Autism was not captured. We're waiting for the next census to happen, and I hope they capture that. In fact, as we speak, the National Family Health Survey is being undertaken by the government, which is huge. I don't think they're capturing, do you have autism? Like who or how many people in your family have it? So in my opinion, having government-approved data is the starting point in this. I think more reliable data from the government would help all of us understand the context and then decide the interventions or whatever it is I'm providing, is that even adequate?
Right.
I mean, today when we work with families on our campus, there are 2 or 3 centers, government-approved centers that certify the condition, right? Honestly, we need more.
Absolutely.
Not just in Mumbai, but I'm sure that's the condition all over the country, right? Why am I so hung up on government certified? Because if you have to avail of any of the schemes that the government puts
need
out,
the certification.
you need a government certified document,
yeah.
and just any other will not cut it. So that is why, and I think that's really where the starting point in this. After that, yes, in terms of education, we can talk about schools and curriculums, but I would actually keep it more at a macro level. There are so many public gardens that exist, right? How can we have adaptations within those gardens that solve for children like us? What do I mean? My child with autism may not have great balance, even if they're older, right? So a swing with a harness would go a long way. When you're doing the slides, you get these roller slides. So when the child rolls down, they get this sensory perception that goes to them, and it makes them feel good. Very small things, Namita, and so easily doable, but will have to be done at the government level. Right? I can even talk about sensory spaces. So, the activity level at an airport or a stadium is just so high, it makes my child uncomfortable. So having these sensory spaces where they can just go in for a few minutes with their families or parents and calm down, they're not constantly stimulated, lighting is easier for them.
So they could take a little break and then come back.
Take a break from the sensory overstimulation that they're getting in spaces.
And that's very easy to do.
Very easy.
Yeah.
I mean, extend that to a toilet, right? A gender-neutral toilet. So if my adult with autism needs some assistance, they can go into those spaces. So I think there are very, very many things that can be done at the government level, very low-hanging fruit, but would go a very, very long way in solving for this. And I think the first step in all of this comes from just awareness. If I'm aware that this is what they need, from that will also enable me to form acceptance of the condition, which will then translate into inclusion that we all, kind of working towards.
And Anaita and you beautifully explained the role of team members, right? It takes a community to support these young adults and children. Do we have enough experts? Whether you talk about the behavioral therapy or the speech therapy, do you have enough training, enough certification, enough people getting this expertise so they can be those team members, or do we have a shortage of these experts?
Short answer, no, we do not have enough.
Huge shortage.
Huge shortage at multiple levels.
And that is the reason that you feel if you can just spend little time teaching the parent, that's one of the ways to bypass these shortages. I mean, it is there. So you have to give the child something, and you have to at the same time manage with as minimum members or staff who can help.
So then you make the parents more self-reliant. Like you said, you work a lot with the parents. So Anaita, you meet so many parents and children in your clinical practice. What is the one message you would like to give parents?
So one of the things I tell them always is to try and identify the strength in their child. Every person has a strength, okay? So while their social and communication issues stand out as weaknesses in them, every person has a strength. If the parent can identify that strength, what I want is them to then take that strength and use it as a source for a vocation, a source for a future, and a better chance of inclusion. So very often what happens is after a certain age, when schools don't take them or don't accept them, or 18 years or 25 years, they just sit at home and do nothing. But if that strength is identified, we can use it to keep them engaged lifelong in a vocation which falls within what they enjoy, are happy with, and are good at.
That's fabulous. And that can make sure that they have a very productive and happy life, right?
Absolutely.
Fabulous. Archana, let's come to you. Let's talk a little bit more about what kind of schools can support children with autism better.
I think we must have inclusive schools, right? And all schools should be running on the principles of universal design learning. So you teach the way the child needs to be taught, right? And like Anaita talked about, the whole strength-based approach. This will have to be supplemented with the therapies. And I think the schools being inclusive is such a great way to have friendships, right? Where you do peer learning, peer supports, because at the end of the day, that's how inclusion in society will happen.
And you also spoke about residential homes and how we can equip them better. Can you speak about that a bit more?
So I think within what all the government can do, one of the things is also building more residential homes, because sometimes our kids cannot be integrated or cannot be part of a family beyond a particular point. So they do need residential homes which are designed to solve for them. I think what the government can also do is build more employment opportunities.
Absolutely.
Right?
That's a very important point you touched on.
And for those that cannot be placed in outside employment, we can consider sheltered workshops. So at Jai Vakeel, we have a sheltered workshop where we have over 300 adults working every single day. And, you know, at the end of the month when they get their stipend, there's such a feeling of accomplishment.
Such
because
pride in their eyes. I saw that.
Yeah.
I bought a lot of their stuff and they just that look in their eyes.
Absolutely, because
beautiful.
they also feel like I'm contributing towards my house. So, and nothing builds self-esteem like that.
Absolutely. So beautifully said. So, Archana, where we were is we were talking about Ishara and how we need to change our lens. And so how, as an Anaita, what is it that I need to do to support autism better?
I think it comes from a place of just coming at it with empathy, love, and kindness, right? The minute you make the effort to understand the space and come at it with these three, you're done. And understanding that, you know, just because a person with autism cannot speak doesn't mean they have nothing to say. So how is it that we can communicate? It can be through assisted apps like Avaz, or it can be through gesticulating, etc. Because they are nonverbal doesn't mean we do not speak to them, right? But we have to speak to them mindfully, where we speak slowly, concisely, and clearly, so that they are able to understand what we are saying.
And so beautifully you spoke about kindness, because a lot of times what I see in my kids' school is a lot of bullying. When we see something that we're not comfortable with, or we feel behavior is different. So you rightly said that kindness goes a very long way. And one more thing that goes a very long way, Archana, stories. You know, I always tell people, I forget Gyan, but I'll never forget stories. So just before we started, you were beautifully telling us, you gave us one story of Ishara, but you were talking about a couple of TV shows. She spoke about Rainman, and you were talking about a couple of movies that have helped us appreciate and understand these conditions better.
So I loved the movie Barfi, right? In that,
so did I.
Where Priyanka Chopra plays the character of an autistic person. And she does, of course, display some stereotypical behaviors. But I think the message was far more than just her condition, because she falls in love with Ranbir, who I think is hearing impaired and uses sign language. But the bond between them, the love between them, the understanding between them transcends all these issues, right? I mean, that Jilmil is such a pure character that for her, the fact that Ranbir wasn't speaking was a non-issue, right? And I think that's what true love is, right? It goes beyond labels or abilities or any of that. And I think having more such movies or TV shows which showcases these in the correct neurodiverse approach is really what we need to understand.
Absolutely. And you know, Barfi's done a great job. Even we were discussing Tare Zameen Pe, which shows dyslexia. We spoke about Good Doctor, which is such a popular American show that also, so I think we need more of that so people around us get educated. Let's do one thing. Let's take a little break from this serious talk to do a myth and a fact buster. Are you guys up for it? Okay, so let's start. I'm going to ask you a couple. Just say myth, a fact. You can add one or two sentences if you like, but we'll make this pretty rapid fire. So we'll start with you, Anaita. Vaccines cause autism.
Myth.
If you have a child with autism, there's a higher probability that the sibling, your second child, will also have autism. Myth or fact?
Fact, but a very small percentage.
So there is evidence around that.
A small percentage increased chance.
Got it. Over to you, Archana. First question, all autistic children have intellectual disability?
Myth.
A second question, boys are more prone to autism than girls. Myth or fact?
Fact. In fact, the ratio is almost 3:1.
Oh, that's a very large number. Fabulous. And you know, that brings us to the end of another fabulous podcast on autism this time. There is so much information that we gathered today, but the one thing that both Anaita and Archana keep talking about, two words that stayed with me. One is inclusive. Let's have a more inclusive society. Let's not judge for differences. And second is kindness and empathy. If you can be anything, be kind, be supportive, celebrate the differences. There are a wide spectrum of neuro conditions that we still need to talk about. There's OCD, there's ADHD, there's dyslexia, there's bipolar disorder, there's Down syndrome, there's schizophrenia, there's cerebral palsy. The list is endless. We will be taking on each of these conditions in future episodes. We will get educated, we will support, we will celebrate the differences, we will build a kinder and more inclusive society. Thank you very much.